Hi, my name is Harshal. Welcome to Decode Healthcare with Harshal. As you can see, this is radiology questions. You have around 2 to 3 minutes to get the answer. If you have already got the answer, why not move ahead in the video and you will get the answer, whatever is the correct one for this one. I help fellow medical coders, so why not give you a like and subscribe to this channel as well. I try to push more content on this channel. Right, a patient undergoes a complete abdominal ultrasound due to persistent right upper quadrant pain. The physician documents evaluation of the liver, gallbladder, bile duct, pancreas, spleen, kidneys, abdominal aorta, and inferior vena cava. You have got these four options. Try to answer as quick as you can. All right, answer to this question is option A, 76700. And yeah, as rightly said by a few of them in the previous videos, they need a rationale in the right below the answer as well. So I've written the rationale as well. So 7600 reports a complete abdominal ultrasound. Documentation includes all the required abdominal organs and structures. Code 705 is for limited abdominal ultrasound, and 70 and 75 are for renal studies. Moving on to next one. A patient presents with chronic headaches. A physician orders an MRI of the brain without contrast material. Images are obtained and no contrast is administered during the study, which a CPT code should be reported. Yeah, and I mean, I do check your comments, so please mention in the comments what do you have in mind? What is the feedback on the content? If you're looking for something in particular, do let me know that as well. I'll try. I'll try to help you on that as well. Alright, if you have not got the answer, please pause the video. The right answer to this question is option A, 70551, as it represents MRI brain without contrast. 52 is only with contrast, and 53 is without followed by with contrast, and 50 is a CT scan and not an MRI. Moving on to next one. A radiologist performs a chest X-ray consisting of frontal and lateral views for evaluation of persistent cough and shortness of breath. Which CPT is most appropriate here? If at all, if you have problem with the answers, do let me in the comments as well. I'll again check if I've got the right answer or not. Yeah, I mean, you can help me out on that part as well. All right, the correct answer to this question is option B, 71046, as it describes chest radiological examination to views, frontal and lateral views equal to two views. The remaining codes represent one, three, or more than four views. Moving on to next question. A patient undergoes a CT scan of the abdomen and pelvis with intravenous contrast. Both anatomical regions are imaged during the same encounter. So what will be the CPT code or the CPT code combination will be reported here. You can still see you have not liked the video. Please like the video so I can do more content. All right, the correct answer to this question is option B, that is 74177, as it reports correctly for CT abdomen and pelvis with contrast. 7.6 is without contrast, and 7.8 is without contrast followed by with contrast. So reporting separate CT codes would be incorrect because a combination code exists. Moving on to the next question, question number 5. A complete retroperitoneal ultrasound is performed. The physician evaluates both kidneys, bladder, aorta, vena cava, and retroperitoneal structures. Which CPT code should be assigned here? Don't ask me to play music on this video, dude. Another easy question. So the answer to this, if you have not got the answer, please pause the video. So the correct answer to this question is option A, 76770, as it describes a complete retroperitoneal ultrasound. 75 is for limited, and other codes are for different anatomical regions. Moving on to next question, a patient receives a screening mammography of both breasts utilizing computer-aided detection when performed. Which CPT code is correct? The answer to this question is option C, 77067, as it reports bilateral screening mammography. And other codes are for the diagnostic one. 63 is an add-on code. So moving on to the next question, a physician orders a CT scan of the head without contrast following a minor head injury. A radiologist performs the examination without administering any contrast material. Choose the correct CPT code among the four here. The correct answer to this question is option A, 70450, as it represents CT head brain without contrast. And rest of the course, you have got the information over here. Moving on to next one, a complete pelvic ultrasound is performed using a transabdominal approach. The uterus, endometrium, ovaries, adnexal structures, and pelvic cul-de-sac are fully evaluated. Which CPT should be assigned here? Answer to this question is option B, 76856, as it describes a complete pelvic ultrasound, non-obstetric, transabdominal. Right. Moving on to the next one, a patient undergoes fluoroscopic guidance for placement of a central venous access device. But the radiologist provides imaging guidance only and documents permanent recorded images. Get the best part about out of this four here. The answer to this question is option A, 77001. So, before going to the last question, you have still not given a like. There are few, not you particularly, there are few that have not subscribed to the channel. Please subscribe to this channel, dude. All right, moving on to the last one. An MRI of the lumbar spine is performed without contrast and subsequently repeated with contrast administration during the sensation due to abnormal findings. What CPT code should be reported here? All right, the answer for the last one. Uh, Before calling out this answer, my name is Harshil, and thank you for watching this video. Also, let me know in the comments what do you think, what can be improved, what can be, uh, you know, uh, done in the future on the future content. Do let me know if you need any help, any sort of help. All right, the answer to this question is 72158, as it represents MRI lumbar spine without contrast, followed by with contrast. There you go. Again, please like, I mean, I have to say it again all the time. But if you have not liked the video, please give it a like. And yeah, thanks for watching. I'll see you in the next one. Bye bye.